Hello, and welcome to the third edition of Cavanac's Educate and Protect video podcast. My name is Megan Dickerson, Director of Risk Control here at Cavanac, and your host today. These video podcasts are designed to be short 10 to 15-minute Q&A sessions on current and relevant topics affecting your business. Our goal is to help you better understand the present so you can have confidence in the future. We're back today with our guest speaker, Diana Dix, Human Resources Risk Advisor for our Expanded Core clients. Hi, Diana.
Hi, Megan.
Today, we are here to talk to you about the new COVID-19 notice requirements for California employers and Cal OSHA enforcement changes. Diana, what is AB 685 and how does it impact California employers?
Yes, thank you, Megan. Now, Assembly Bill 685 is a new law that requires both private and public employers to notify their employees who have been exposed to COVID-19 and to report workplace outbreaks to the local health department. Now, even though this law goes into effect January 1, according to California Department of Public Health, that obligation to report exposures have already been in effect. So for the most part, California employers have been accustomed to providing some sort of notification to their employees when there is an exposure. But aside from providing specific notification, depending on the recipient, the law also requires California Department of Public Health to publicly report information on workplace outbreaks by industry on their website. Now, additionally, with this law, it also gives certain authorities to Cal OSHA to enforce COVID-19 hazards as an imminent hazard to provide immediate protection to their workers.
Okay, so that's a lot. Let's break it down. Let's start with the employer notification to employees. So it's my understanding that the new notification employers have to give is pretty specific. Can you explain to us what triggers the notification and what must be included?
Yes, and like I mentioned earlier, it depends on the recipient as to what information is included. But in a nutshell, within one business day of being informed or identifying a COVID-19 case in the workplace, you have to provide written notice to your employees, to the employer of subcontracted workers, if applicable, and the exclusive labor representative, if there is one of a potential exposure. Now, under AB 685, a COVID-19 case is someone that has has a positive viral test, has been diagnosed by a licensed healthcare provider, is ordered to isolate by a public health official, or dies due to COVID-19. Now, the notice should inform employees that they have been exposed to COVID, and you can include the dates that the individual who has tested positive was at the work site, but you've got to be very careful because you don't want to share any information that's going to identify that individual. Now, the notice must contain information about COVID benefits under federal, under state law, and local laws, which you're thinking about your workers' compensation benefits, company paid sick leave, or any kind of state mandated leave of absence, which we talked about in one of the other podcasts about CVRA going now into effect for employers with 5 or more employees. So that will apply, and any kind of supplemental leave. And you also have to include what are the protections of employees against retaliation and discrimination. And you also have to include in that particular notice what your company's disinfection and safety policy or plan is for that work site, obviously in accordance to the guidelines by CDC. But you have to provide this type of notice to employees that have been present at the time that that individual who tested positive was at the work site during that infectious period. And the notice can be either hand delivered, you can email it, you can text it to your employees, and it also has to be both in English and whatever other language that is understood by the majority of your employee population.
Okay, so for a lot of places that's going to be Spanish, but There's a lot of other ones here, especially in Southern California. Okay, so you mentioned the infectious period. And what exactly does that term mean, given the recent changes that the CDC has posted?
Yeah, of course. Now, the individual who has symptoms, that infectious period begins 2 days before the onset of those symptoms, and it ends when 10 days have passed since those symptoms first appeared, and at least 24 hours have passed with no fever or and other symptoms have overall improved. Now, for that
so
individual,
10 days and 24 hours, or 10 days or 24 hours?
And there is no fever, so that has to be
important.
Yeah, that is important. Now, for those individuals who do test positive, but they have no symptoms, right? Asymptomatic. That infectious period begins 2 days before that specimen was collected, and then it ends 10 days after it was collected. One thing I do want to just remind people is that for those who have been exposed, but there has been no test, meaning there's no specimen that has been collected, there is a 14-day period of quarantine according to the CDC. That has not changed. For those who have been exposed to someone who has tested positive, you still have that 14-day quarantine period in place.
Okay, so I mean, that's very specific with days before the test was collected, days before symptoms started. So really, I think this means employers have to have a pretty good grip on who's coming and going and who is on the premises at any time, and kind of track that really closely, which I think is really good to know up front as we prepare for this going into effect. But so we'll talk about what we can do to prepare a little bit later on. But for right now, let's move on to the next requirement of the new law. And so when would employers be required to report COVID-19 cases to the local health department?
When there's an outbreak. Now, an outbreak in the workplace, according to AB 685, is defined as at least 3 COVID-19 positive cases at the same work site within a 14-day period. Now, employers have 2 days, it's 48 hours, that's not 2 business days, to report to the local health department of the outbreak. And then you, of course, have to continue to notify the local health department of any additional COVID cases that do occur within that same time frame at the work site. But one thing I also want to remind you all is that you've got to also comply with your local health department ordinances, because they may have very different. So for example, if you're in San Diego, you have a positive test, you have to report every single positive test that comes into the local health department. So It's not just like the outbreak. So you also have to make sure that you're complying as well with your local health department ordinances as well. But basically, when you report it, when you're calling them, you're going to provide company name, business address. You're going to include that North American Industry Classification Industry Code. Also, the names of the workers with COVID-19 case, their occupation, and then obviously any additional information that they're going to request as part of that investigation. And then, like I mentioned earlier, the local health department has an obligation to share this information of outbreaks with the California Department of Public Health, and they are required to share this information of the outbreaks on their website to the public.
Okay, so just to kind of recap, like this is a statewide assembly bill, and the requirement under this statewide assembly bill is that you report an outbreak, which under this one is defined as 3 or more employees within 48 hours. But keep in mind that Senate Bill 1159, which we talked about in a previous podcast, defines an outbreak very differently. They define it as 4 employees or 4% of your workforce, depending on how big you are, and you have 3 days to report that. And also we need to keep in mind that local public health organizations can have a stricter standard. So in San Diego, we have to report every case. So there's a lot of moving parts going on here. And it's, we got to try to, make them all work. So it's good to keep all of those in mind. But, nothing is simple and easy to understand in California. So that's why we have jobs. It's so much fun. Okay, so what enforcement authority does AB 685 give to Cal OSHA? Because that's a whole nother requirement.
Yeah, it basically allows Cal OSHA to close your doors to protect workers from an imminent hazard as it relates to COVID-19. And it also allows them to cite, to fine employers for serious violations without having to provide that 15-day notice. And then also it allows them to cite or fine employers for violations of the worker notice provision under AB 685.
Okay, so that sounds definitely like something we all want to avoid. So tell me, this is going to go into effect in January. Is that right?
Yes, January 1.
1st. Okay, so we're about 60 days out, a little bit less. What should employers be doing now to get prepared or get into compliance for when this goes into effect?
Yeah, I think for one, the most important thing is designate either an individual or a team within your organization who is going to be the point person. As you mentioned, there's a lot of moving parts when it comes to not only this bill, you also have the workers' comp 1159 bill, and then you also have local agencies that have their own requirements. So you do need someone that's going to be the point person who is going to be able to comply with all these requirements and the time sensitivity that is required or imposed into these different these laws. So making sure that you have a point person or a team of individuals, and this person should be staying up to date with what's going on, the changes, the ever changes with COVID-19, or have a trusted resource they can count on to provide them with the information that they need so they can stay informed. And this is where your Kavanac risk control team comes into play. It's a cheap plug, but it's true. Second, you have to have, you want to have a template. Start working on your template now that you can use that's going to comply with all those notice requirements. They're very specific. So your notice is going to be much longer than what you're used to giving today. We're currently working on this template for our clients, so that will be available probably the beginning of next month. We'll make it accessible to everyone who needs it. And then you also want to document your efforts that you have taken to notify your employees. If you're not going to be using the form of an email and you're going to hand deliver this, then you need to have something that's going to show your efforts of communication to those employees who have been exposed. You may have situations where you have employees who refuse to take a test. Again, you want to document your efforts in that situation. You have a very short window with those written notices and notifying the local health department regarding what are those exposures, and you're going to need to act very fast. So constantly remind employees that if they're sick, stay home, get seen by a physician, so in that way they can rule out COVID-19. But I also want to remind you all that as you think about the reporting requirements, think of 1, 2, 3, right? There's 1, 2, 3. 1 day of notifying your employees once you become aware of a positive case. You have 2 days to report an outbreak to the local health department, and you have 3 days to report workers' comp to your workers' comp carrier of a positive COVID-19 case. So remember 1, 2, 3. That might help you a little bit. Again, we're going to be having the sample notice for you all available very soon, so in that way you have that in your toolbox.
Right, that'll be a great resource. Yeah, so thanks for putting that together. I know our clients will appreciate that. Okay, so all of that sounds smart. I mean, it's a lot of detail and it's a lot of work. There's multiple layers of requirements, and just like everything in California, but particularly with COVID, it sounds like this can get kind of convoluted. So, if I have a message, and I think I share this message every time we get on one of these podcasts, that we're here to support our clients. Now more than ever, you want a trusted advisor on your side. That's something that we've always prided ourselves on. We've always worked to support our clients through their risk control challenges. It's one of the reasons why we invested in people like you, Diana, and why we developed our expanded core services. But especially in challenging times like these, this is why we're here. So definitely, if you have questions, if you don't know how to navigate through all of these requirements, please reach out to us. Not just for COVID, but also we're going into a hard insurance cycle here as well. So now is really the time to get your risk control ducks in a row. It will pay off later, and just don't hesitate to reach out to us to ask for support in that. So, okay, so this wraps up our third session of Educate and Protect. Diana, thank you so much for joining me today.
Of course.
Yeah. Stay tuned for more video podcasts presented to you by Kavanack. We try to get these out once every 2 weeks or so. Sometimes it's a little more frequent, sometimes a little bit less frequent. But also I wanted to let our viewers today know that on December 2nd, we're going to be hosting our annual employment update, which is a seminar we do every year. This year, I'm assuming it'll be virtual, but we're going to have presentation by Iris Christoph and Brad LeBeau, who are attorneys with Dunn, DeSantis, Walton Kendrick, LLP. And they're going to be summarizing key new labor and employment laws and the steps to take to be prepared for those changes which are coming. They're going to go into effect in January 2021, just like this Assembly bill, but lots of others. So if you're interested in that, and invitations for registration are going to be going out via email next week. And so look for that. And thanks for joining us today. And Diana, thanks for being with us. And
thank you.
Everybody stay safe out there.
Yep. Thank you.